Okay, we're going to get started. Welcome everybody to the first conversation in Dalhousie University's Healthy Populations Institute speaker series on closing the gap between research and policy. I'm just going to give you a little bit of an overview about HPI. I'm Sara Kirk, I'm the Scientific Director of the Healthy Populations Institute. We basically aim to improve population health and health equity in Atlantic Canada and beyond by understanding and influencing the complex conditions that affect the health of communities. And as an institute that's situated within academia, we often ask ourselves why it can be a struggle to bring great academic research into the halls of government. Academia generates huge volumes of evidence that can guide policy, and most academics want to improve the world through their work. And most governments talk about the need for decisions to be evidence-based. So there is both supply and demand, but there's sometimes that gap between the evidence generated and how that then gets into the kind of key policy decisions. So joining us today to explore this conundrum is Mike Davis, who is the Chief Executive Officer of Davis Pier Consulting, as well as President and Chair of the Board of Pier Labs, the social innovation outpost of Davis Pier. Mike has 20 years of experience with government clients in Canada, as well as Europe, Africa, and Asia. And he's well regarded not only for his ability to design and architect strategies and solutions to complex public sector issues for clients, but also for overseeing their implementation. Mike leads Davis Pier's social innovation efforts focused on helping government by using behavioral science, service design, and evidence-based policy approaches to improving policymaking and program design. Mike has a master's degree in behavioral sciences from the London School of Economics, as well as bachelor and master's degrees in industrial engineering from Dalhousie University. He's on the board of directors of Kids Help Phone, as well as the Tribe Network. I'm going to hand over to Mike in just a second, and he's going to lead us through his presentation. There will be some time for some questions at the end, and we've had a few questions submitted ahead of time as well. Just a reminder to mute yourself if you're not speaking. Feel free to leave your camera on or off. I think that's okay. Hopefully, our bandwidth will be protected today. And with that, no further ado, I'm going to hand over to Mike. So take it away, Mike.
Thanks, Sarah. Appreciate that, and appreciate the opportunity to speak about something that I've, I guess, become quite passionate about in the last 5 years, which is trying to unpack how to support government policymakers in using better information, which is then in theory going to lead to better outcomes. So as Sarah said, I've got some quite a bit of experience as a consultant, and I have to say that I'm embarrassed to admit that it's only within the last 5 years that I really had an understanding of the breadth and depth of evidence that exists in the world of mainly in academia that researchers generate, and so I guess my path to getting here will hopefully provide a little bit of context. So I was educated formally and worked as an engineer first in industrial and systems engineering, and applied that kind of mindset to the public sector and working as a consultant supporting public sector projects, improvement projects. And when we founded Davis Pier, one of the things that we wanted to do was try to generate as much impact as we possibly could with the work that we did. And frankly, some of the projects that I was involved in, where we had relatively high hopes about the benefits we could drive and impact we could drive, kind of underperformed and underdelivered. And so that sent me on a bit of a path to think through, are there ways that are there different ways that we could be tackling some of these complex problems, which introduced me to, broadly to the concept of social innovation and participatory design and research, and then even more specifically into the world of behavioral science, which is sort of a niche area that is a combination of economics and psychology and sociology. And it really was through that education that I really did, I think, sort of morph into more of a social scientist and having more of a social science outlook on things. And so what I've been trying to do over the last number of years is integrate evidence and those practices into more of our work, and frankly, advocate to governments and decision makers to utilize more of that. And so that's sort of what brings me here today. And I'm fascinated by government, and have been for quite some time. Both of my parents were public servants. My wife is a public servant, and I have worked almost solely with government or community organizations for the last decade plus, almost 2 decades now, and have actually spent time within the civil service as well. And I understand the frustration that people have with government, and so, you know, I tend to start these conversations out trying to help people understand, you know, my perspective on government, right? And so I've written, informally written and spoken about this topic in the past, and to talk about sort of why is it that things seem that there are so many societal ills that we believe government should be doing a better job of tackling, and yet we see a lack of progress. It's been a topic for me, you know, that I have thought a lot about over the last number of years, and I guess my theory is that, you know, to some extent, anyways, maybe to a large extent, I think a lot of the issues we have with government is a lack of understanding of how government works. And so one of the things I want to talk about today is to sort of, you know, let people see kind of behind the curtains of the Wizard of Oz, to understand what is actually going on. So I am a bit of a government kind of public sector apologist in some regards, just because I've spent a whole lot of time working in and with in the public sector, and sort of seeing it for what I believe it is, which is a number of incredibly well-meaning public servants that are under pretty significant demands and scrutiny. And so I'll give you an example, and we'll start with government policy. So this is, if you Google the policy process or government policy process, you'll see some version of this type of cycle, right? So at the top, we've got problem identification. So call that climate, call that poverty, call that poor health outcomes, call that urban mobility. You know, you've got politicians that set an agenda. So they identify these issues, and they go about setting the agenda to address certain things. So for instance, I think it's no surprise to people that our new provincial government that was formed in the fall, during the election, they ran on a very health-centric platform, and that has become a big part of their agenda. Then we get into the policy formulation machine. So that involves, you know, research and decisions within internal to government, and it involves, you know, stakeholder consultation and engagement and whatnot to land on some type of decision that ultimately is implemented through legislation or regulation change, or perhaps neither of those things, but changes to funding, changes to programs and policy. We get into, you know, that decision's made, we get into implementation. People benefit from whatever it is those changes have been. We evaluate that, and that leads us back to, did we solve the problem or not, or what is the new problem? So, and, you know, to be clear, you know, the word policy, even the word policy, I understand is, there are different sort of opinions, or not opinions, but different definitions of what policy means. So when I talk about government policy in you know, over the next half an hour, I'm just talking about sort of the government decision-making machine. So not necessarily operational policy or detailed policy, more so the direction the government wants to go. So this is, in theory, how policy is made, but in reality, it is different than that. So yes, we would identify a problem. So at that question mark, politicians then, the reality of being a politician is that you run by, to some extent, by understanding the issues at hand, but also to some extent by being popular with your constituency. And so politicians oftentimes are thrust into roles as ministers, as part of cabinet, without necessarily having much in the way of an understanding of a detailed policy agenda that they have responsibility for, right? So people don't become politicians and then ministers of certain files or ministries or departments because of their deep subject matter knowledge of that area. So they'll set a direction. The policy formulation sort of then happens, and it is not clear cut as to sort of how that happens or works. Sometimes a policy is formed sort of at the cabinet table in the blink of an eye in a snap decision. Other times it takes months and years to try to formulate that. Managing stakeholders' expectations is difficult. Trying to get people, the average citizen, to engage in that process is very difficult. And then there is, of course, the sort of the scrutiny of the media that politicians and government, I guess, not just politicians, but government needs to address in frankly what has become a bit of a gotcha sort of state that we've got now. Fully appreciating, that people and press need the ability to sort of question government decisions, but that does create a behavior of risk aversion, frankly, within government. So, and there can be a whole lot of back and forth. Agenda is set, policy begins to be formed, changes the agenda, maybe a decision is made, maybe we get to make the decision and we're not sure about it, and so we go back to the drawing board. So that becomes a bit much less clear as to sort of how that works out. So a decision is made, we think we've made an all right one, we get into trying to implement that policy and find out that implementing things within a public sector environment is very, very difficult. Because of competing priorities, because of under-resourced departments, because of the rules and regulations around whether it be privacy or procurement or what have you. So usually what will happen is the policy direction is implemented. It oftentimes under delivers on what has been sort of suggested it will deliver on or is promised. And then you've got people that are disappointed with the results, and real people that need supports, whether that be housing or healthcare, or you pick the ream of issues that are out there. That creates a not only dissatisfaction but pretty significant advocacy in some ways, that then becomes another sort of stakeholder group for government to manage. And so I say all that as a little bit of context as to what I have observed from government and what this all comes down to. And really, for me, what it pointed to was a need to better understand humans and human behavior, because all of the processes and the systems and the dynamics that I just have articulated really come down to the collection of human beings that need to work together and make decisions. So it's always it's easy to find a Winston Churchill quote when you are presenting on government. So fully appreciating that he had sort of helped move the United Kingdom's colonialist practices, and is, I think, when you look at what he has done, when we look back on what he's done, probably was not the most forward-thinking individual as far as sort of race relations are concerned. This quote does certainly resonate. And I like putting it up here, talking about sort of democracy as the form of government that we know is indeed said to be the worst form, except for all the other forms that have been tried from time to time. And I put that up because while it seems like we do have lots of issues with our system, You know, the reality is that's the system that we've got, and it's probably the best one. And so, I guess, I am a believer that we're not going to necessarily sort of change the structures of democracy. So let's figure out how to work within them. So David Halpern, who said this quote, is the chief executive of an organization in the UK, well, international now, but started in the UK, called the Behavioral Insights Team. And Halpern also has been an advisor on evidence-based policy to the UK government. And so I'll just read the quote. The dirty secret of almost all government is that we don't know whether we're doing the right thing, whether what we're doing is helping the patient or not helping the patient or even killing them. People are often running blind, overconfident, and dispensing massive sums of money. And so I think, you know, that quote really resonates with me, because he has spent his lifetime looking to incorporate evidence in decision making. And this has also been my experience as well, that there are huge investments made by government on an amount of evidence that, you know, can be shockingly low, and not because people are incompetent, but because of the pressures of government, and because people are humans. And so we're gonna talk a little bit about that. So what I want to talk about is, how do we actually address all that? How do we actually close the gap between these critical decisions that are made and the use of evidence and research? So just want to level set on, and when I say evidence, what I'm talking about. So, you know, and for two reasons. One, just so that we can level set, but also just to demonstrate that even the perspective or awareness of what evidence isn't broadly understood within the public sector, as far as I've observed. So we're not talking about using data, we're talking about actually using evidence. So using evidence or data that has been generated through an approach that is intended to do so, right? So that we can actually get to the root cause of why things are the way they are, or why they happen in a certain way. So data on its own is definitely important. It supports evidence-based decision-making, certainly. But data on its own is not evidence. And so we'll talk, that's kind of what I'm going to hone in on. So why is it so hard to use evidence? So I mean, first and foremost, incorporating evidence into the policy process assumes that there is a policy process. And I think that, you know, as I presented, you know, just a few minutes ago on what the policy process is in theory, it very rarely works that way. And so, you know, the first challenge in trying to figure out how to use evidence in the policy process is exactly at what point in time and with whom you need to interject evidence into that entire sort of machine or experience. So there is definitely one issue or barrier to using evidence within government and policy. There's some other issues as well, and you know, really stemming from the nature of government. Government is not set up to easily allow for evidence generation or evidence use. The expectations on government are quite high, as they should be, which means that timeline pressures are also pretty significant. And so if they're, which means that decisions need to be made very quickly. So, you know, when a new issue pops up, being able to sort of start from scratch and to generate evidence, or really think through all the different aspects of evidence can be difficult. Now, it depends on the policy area we're talking about. Of course, you know, I know that many of you come from sort of the healthcare and health sciences background, and as a result, you know, incorporating some of that evidence into medical practice is a little bit different than say trying to incorporate social science research into complex issues like affordable housing, for instance, or child poverty. If you think about the pandemic for a second and how evidence was used, I think in many ways there were many jurisdictions that have been put on a pedestal as far as the use of evidence in its decision making. I know Nova Scotia in in many regards is seen in that light. But if you think about the evidence that was used, it was very, very skewed towards epidemiology and infectious disease, infection control, which of course it should be. But there wasn't a whole lot of conversation around the incorporation of evidence on the mental health impacts that isolation might have, on what may or may not result from developing the CERB income supports. Those things were done in order to align with the evidence from an epidemiology point of view, and there really wasn't an opportunity to look holistically at the full body of evidence, because we were in a pandemic. The second thing is that government has a bias against experimenting, and so of course there's lots of evidence that's already out there that can be utilized, but when there is a need to generate new evidence, having a conversation with policymakers about trying different things and experimenting is very difficult to do. That has been my experience, for a few reasons. The main one being that, I think there's probably two. One is that in order to do an experiment, you will be treating, arguably treating different people. Well, not arguably, you'll be treating different people or different groups of people differently, right? And so that fundamentally is difficult for policymakers to get their head around. Of like, if we know that this is a good idea, why wouldn't we give everybody, this one intervention or one program? Well, because we don't know definitively that it is, and that's why you do the experimenting. But that is a hard conversation to have sometimes. I think the other one is also the perception that you're going to try something and spend funds on it, and it may or may not, sort of stay as a program. There is a perceived risk of what people will think about spending money on something that may not end up sticking around. There is a bias against utilizing data, or at least utilizing data to the extent that it could be used in order to further generate evidence. And what I'm around the privacy concerns of doing that. And I have on countless occasions met with privacy professionals to walk them through sort of, what it is that we would like to do in terms of evidence-based generating evidence, or using data to generate evidence, or what have you. And we often land in the same place, then, okay, yes, we can do it, and we need to have the privacy sort of protections in place. And I by no means am suggesting that privacy isn't important, because it absolutely is. But it's less about having those pieces in place and more about the process that you need to go through, again, to be able to utilize that data. Makes it a disincentive for many people, that frankly they don't want to engage in the conversation because it becomes too hard. And the final thing, just on some of the challenges with government, is that while there is lots of evidence out there that has been generated in peer-reviewed journals, and I think specifically around maybe some of the social science areas, much of the research can be context specific, meaning that something that works in a lab at Harvard or Cambridge or something like that may not work in the real world, or something that worked in one country or in one jurisdiction, again, may not be replicable in another as well. And so that makes it more difficult to utilize evidence. So, which brings me to this concept of behavioral science and what that all means. So, just to make sure that again we're kind of on the same page, in a nutshell, behavioral science is this sort of niche area that takes pieces from psychology and sociology and economics and neuroscience to help us be able to sort of understand and predict why people will behave in a certain way that kind of seems irrational, or at least goes against what we would, the assumptions of rationality would suggest that they would do. And so I've become quite interested in this field because it has been very helpful to both understand how citizens may interact with an intervention, but also how public servants will behave, because they are humans as well, and in trying to get them to embrace the use of evidence. So because government is made up of a collection of humans, one of the theories that is sort of a working theory for me is that there are some key behavioral barriers or behavioral biases that further make it difficult to use evidence. So over and above the structures of government, we've got these barriers. So things like choice overload. So what behavioral science shows us is that humans have a finite amount of cognitive bandwidth, and which means that we can only process so much information at one time. So if we are presented with too many choices, you either make suboptimal decisions, or it creates a status quo bias in our heads, and it means that we decide not to make a decision at all. And if you are in a senior role within government, you are constantly barraged with a variety of issues and problems and stakeholders to be managing. So to try to incorporate a new practice of using evidence can become quite difficult for people to get over the hump on. Present bias is another one. So we, as human beings, significantly overweight things in the here and now at the expense of the future. How this plays into the use of evidence is that governments tend to be more present biased. They tend to be trying to figure out the solutions or solutions to problems right in front of us at the expense of the future. There is no better example of this than climate policy. The costs of addressing the climate crisis are in the here and now and carry a much more significant weight in our heads than we even know, than the future benefits of actually addressing the climate crisis. So I know that when we think about that rationally, what I'm saying is, that it can be easy to sort of suggest that, well, we sort of need to get over that because we are literally staring down a crisis. And what I'm suggesting and pointing out is that, yes, that is absolutely valid. It's just not the way that our brains are wired to work. And as a result, it's another barrier that we need to overcome. Confirmation bias is one I know that we've all experienced, where you look for you have an opinion, you form that opinion, and then you look for information to confirm your own opinion. And so I talk a lot about evidence-based policy. There is also sort of a term that's called policy-based evidence, which is people seeking out proof, facts, data that it better validates the decision that they've already made. And then the final one that I think is salient to this conversation is availability bias, which is the way that our brain or behavior works, where we for something that is easy to recall, we mistake that with the likelihood of it happening. And what that does is it has stakeholders and advocates and citizens and government focus on the things that are probably not likely to happen, but carry a lot of weight in our brains. And so we don't always apply resources in the most effective way possible, because of where people believe we should be focusing our attention. Okay, so that's kind of why I believe it's hard to use evidence in government. Now let's talk about the role that academia could play in this. And I also understand that, so if you signed up for this presentation, you have some desire to at least understand how the research that you're doing or the work that you're doing could be better utilized in the government decision-making process. You've got a desire to help. Academia has this intellectual freedom to generate evidence, which is something that is quite important to government. To research. Of course, academia has considerable research capability and capacity to generate evidence, and a very strong awareness of, let's not even talk about generating new evidence, but an understanding of the body of knowledge as well. So to some extent, of course, universities are going to be set up to at least have the puzzle pieces to help out. But there are also barriers to helping out as well. And it really comes down to, and now I'm kind of, I've never had this pressure, and so, I may be overstating it, but the concept of publish or perish really drives a lot of the behaviors within academia. So I know from what I've observed anyways, is that it is easier to get something published in a journal if it is novel and a novel application of something versus the same thing in a more applied setting, for instance, or even, from what I understand, easier to get something published that has statistical significance than if the evidence that you've generated is that this intervention didn't actually result in anything. That's an important finding that is harder to get actually published. So the point there is that it ends up to some extent skewing academic research towards things that are easier to get published, whether intentional or not. There's a time scarcity within the academic profession where you've got your research work, you are teaching and lecturing, marking, and I understand that there may be a little bit of sort of administrative overhead associated with being in a university. What that means is that it can be difficult to think about some of the things that you would need to do to get your evidence, to get your findings, get some research to a place where you are partnering with government, and we'll talk about that in a second. Funding, again, is certainly skewed towards ensuring that there's something publishable. And the final thing, and I don't think we can understate this at all, is until I actually enrolled in and attended LSE, I had no idea the amount of social science research that was out there. I also had no idea how difficult it was if you're not connected to an academic institution to get copies of papers. And then even when I got copies of papers, because I went back to school in my early 40s. And so it had been quite some time since I was in university, but I still spent an entire professional lifetime not reading academic journals. And so while I did dedicate lots of time to it because I was in a master's program, it isn't easy to pick up one of those journals and figure out what the key takeaways are, or how much weight to put in that evidence because of the relative statistical significance, or how specialized that one intervention was, or the context around it. And so it's very difficult for a layperson to even be able to read and apply evidence to that work. And so, but of course, that's the machine of academia, is to add to that body of knowledge in that way. So how can we improve this? Well, I go back to behavioral science. And so these are three things that behavioral economics or behavioral science will say are keys to making it easier, or to changing behavior, I guess is maybe a better way to put it. So make things easier, change the incentive structures, and do a better job of shaping the message that it's more salient. So I've got four recommendations here that I think warrant some consideration. So the first one is science advisors. So having skilled, senior, competent researchers within the government decision-making structure, I believe would go a long way. I think we've seen this in the pandemic. More than ever, any time that I can remember, chief medical officers of health are out in front of provincial and federal communications and decision making. Everybody knows who Dr. Strang is if you've lived in Nova Scotia, because he was the public health science advisor in that regard. So why I believe there is some merit to it. I mean, first and foremost, from a behavioral science point of view, there's something called the messenger effect. So Humans can hear the exact same information and perceive it differently depending on who it's coming from. And so if you hear things about science and evidence from somebody that you regard as a senior level scientist, you're going to think about them and hear them and give them, you will weight them differently. It also, having somebody at that senior table just will ensure that there is an advocate for the use of evidence. And that person will not only create capacity within the government structures, but also advocate for having more capacity to be able to do more, use evidence in a different way, in a increased way. The second item are rapid evidence assessments. So fully appreciating that there's a continuum of literature review, right? So for the full-blown kind of systematic review, all the way through, we'll read a couple of journal articles. Rapid evidence assessments, I think, would, if they were common practice, it would be a lighter way to ensure that key evidence was reviewed and incorporated in. I think the more that government understands and utilizes a rapid evidence assessment, I mean, what you want to do is almost utilize something called the default effect, which is, if you use it a couple times, get to a place where anytime there's a big policy decision, you want to do one of these REAs. And if you have professionals and researchers doing that and summarizing that, it will reduce the burden on decision makers, the cognitive burden on decision makers, to be able to sort of dig into, what are the key areas of research and evidence that they need to use. And the third thing also is again, these types of reviews will help identify where there may be gaps in the evidence that you want to focus on. The third thing would be trying to close those gaps. So there needs to be increased prototyping and experimentation, utilized by government. And the key, though, I think, is that there needs to be more of that activity needs to be focused on application and less on novelty. So as I was saying before, looking at replicating interventions that have looked to be promising. I think, again, replications don't, if I understand correctly anyways, don't tend to be as sexy as finding new interventions. But from a government perspective and a policy perspective, that would hold incredible value. I think that in order to do this, there is a model where government can create academic partnerships, which reduces the perceived risk. So of experimenting and treating people differently. And then I think that the third thing is that large scale randomized control trials are quite large projects and initiatives. Large scale field experiments are large initiatives. And if we put all of our eggs in that basket, it becomes sort of an all or nothing. It's usually going to be a nothing. So I would advocate for thinking small first, thinking smaller scale, worrying less about the broader scale, large scale experimentation, and just even sort of having this be kind of the foot in the door of, let's try a couple different things out and test which one works in a smaller kind of more controlled yet still field environment. And then the final thing before I wrap up is that I have been and will continue to advocate for policy research partnerships. So there is considerable value in both government, but also academia, investing time and resources to understand each other's worlds, build relationships, with one another, for the good of incorporating evidence into policy. So, I think the first thing that does is the better rapport that you've, as a researcher, the better rapport and credibility you have with government, the more often they are going to come to you with the problem that they are facing. And if they are coming to you and you are able to sort of pull the priorities out of them, as opposed to sort of push knowledge to them, they will be more bought in to the research and the outcomes, and hopefully using those there's a whole field built up around implementation science and knowledge mobilization and knowledge translation, and that's incredibly important. And I guess what I'm advocating for is taking it one step further, and instead of trying to convince people that the research is important, ask them the problem they're trying to solve and co-generate the research agenda with them. Researchers need to understand the decision-making process within government. That is the only way that you're going to be able to effectively get evidence built into the decision-making process. So it's about understanding the process. It's about understanding the stakeholders. It's about understanding sort of who within that department, that ministry, that system, that division really ultimately makes the decisions, and be able to sort of network and advocate with them. And then finally, I think that there, and we're starting to see this a little bit, and I would advocate again more for this. There needs to be alternative sources of research funding set up that specifically focused on application. So Research Nova Scotia, I believe, has done a great job of this. They've co-developed the research agenda with the forestry industry to think about where are there gaps in research towards a more sustainable forestry sector. And I think we need to have more of that, which will ultimately put more weight on the application of research, conducting research and ensuring that it gets applied, as opposed to the outcome being, and I will say this somewhat tongue in cheek, the outcome being just a journal article, and knowing full well that that's not what most researchers want, but that is kind of the institution that's been set up. So with that, I will turn things back over to Sara. I'll try to stop sharing my screen, and we can maybe have some questions.
Thanks very much, Mike. That was very interesting and good overview of the sausage making of policy. I noticed that we have a couple of questions, one question in the chat and a hand gone up. So I'd like to, but I do have some other questions that got sent in as well. I'm going to go first of all to, I'll go to the people who are actually here on the call. So I think I saw Jessie Hiltz put her hand up. His hand up. Do you want to go first? Hi.
Hi, Sara. Yeah, this was a great talk, and I was really interested in the topic because I used to be an academic, and then and I actually met Sara at SESEPA, the Ethics Center, which is a bit between policy and in academia. And now I'm a civil servant, so so I've kind of got to look at a couple different angles of this, and Mike, I just wanted to get your thoughts on one thing that I've kind of noticed, which is, and you didn't really cover it in your talk yet, is it's a bit more on the sociological side. So, for example, I've been in situations where I've been in discussions with various groups over, let's just choose something non-controversial like conservation, where one of the reasons it seemed like policy folks weren't engaging academics is because there was a perception that academics were biased towards conservation and against economic development. And then on the other side, the academics said the government was biased towards economic development and biased against conservation. And so there was not really it was seen as almost like making the issue harder or more politicized to start to engage other groups who weren't quote unquote like directly impacted, like sector groups or something like that. So just wanted to get your sort of feedback on that kind of scenario situation. Thanks, great talk.
Yeah, thanks, Jesse. And yeah, I mean, I think you've certainly lived much of what much of the environment that I've talked about, anyways. So I think I've seen a couple different sort of models. I didn't talk a lot about advocacy. I think it's an interesting one. I tend to shy away from it as far as for a couple of reasons. It's one is it's not my job. The majority of what we do is in consulting, and sort of in many cases we are presented with the policy already baked, and we're asked to implement. but my observation and experience with kind of the advocacy side of things is that it tends to shut people down as far as being open to considering, alternatives, right? And so it kind of comes back to human behavior. And so I've seen more conversations shut down when people show up with an opinion that may not jive with government decision makers than I have seen government decision makers being open to considering something else. So I guess my only thought or comment on it is that, in some cases advocacy is incredibly important, and I'm not suggesting that that as a researcher with a set of findings or an understanding of a certain situation that you don't want to show up and be able to present that. We probably wouldn't be in the same place of an understanding of climate, if, for instance, if we didn't do that. I just think that people need to understand the flip side of when you show up in that way, that there will be a natural entrenchment kind of that people will have. Just a quick anecdote on that. A lot of the research related work that I've done off and on has been in and around poverty and food insecurity. I had conversations with researchers, and one of them specific to food insecurity, and one of them said to me, I've met with the minister on multiple occasions. She was advocating for a universal basic income. I've met with the minister on numerous occasions. I presented the evidence. It's clear that the only way out of this is a universal basic income. He's an idiot. He's not listening. I don't know what to take. Where to take that. And I guess my reaction to that is, well, that minister is going to have a bunch of competing priorities. Is one thing. Universal basic income in the way that the structures of government work isn't that easy to implement. And if that's the way that you're showing up, then even the great knowledge and evidence that you have, it will be human behavior to stop listening to that person, because that is how they are showing up with trying to provide an opinion. So that's my thoughts on that.
Thanks, Mike.
Thanks for the question, Jesse. I'm going to just go for one of the ones that came in ahead of time. And I think this one's actually a useful one for continuing the discussion, because we are running out of time. And I don't think we're going to be able to get through everything. But can you recommend any fora or initiatives to connect researchers and policymakers? So where should we be showing up to have these discussions?
Yeah. I mean, I think I think that organizations like the Maritime Spore does a good job of trying to be kind of an intermediary. I think Research Nova Scotia is another example of that. I think examples that perhaps are examples of things that probably don't get you kind of what you would be looking for would be academic conferences, for instance. You don't have policymakers that end up at those. Probably more kind of I'll say industry, and again, depends on your area of research, but an industry type of conference, for instance, would be the one that I would tend to skew towards. Now, the presentations and the findings and whatnot, or the agenda would be very different, but you would end up going there more to build different types of relationships than you've got, and to learn less or listen less about what the different findings of different studies would be. So that would be kind of my skew. And I saw Heather just pop up a comment in the chat, and so we've been having some good conversations with the Research Nova Scotia, and I think that they have been and will continue to be a leader in that space.
Great, thank you. I noticed that Brittany Barber has their hand up as well. So go ahead, Brittany, with your question.
Yeah, hi, Mike and Sarah. Thanks for the presentation. I just wanted to comment that I have somewhat of a disagreement with the conflicting viewpoint of evidence versus data. And I think that if we were to say, you know, if we have 100% of time, if we spend 90% of time identifying the problem and 10% focus on a solution, then we would probably get a lot further than, you know, some of the strategies that we have today. And I think that brings us to the point of, do we actually understand our own data across Nova Scotia? And I know Natalie St. Jacques is on the call, and she's phenomenal at doing this in cancer care. And I've had the pleasure of working with her to look at some of our cancer care data and then target some of the decisions we make around that. So it's not necessarily just based on evidence, but a lot of the time we don't actually understand the problem that we're facing because we're so focused on what other people are doing. So how do you think that plays a role in how we can support policymakers moving forward for them, you know, to turn things into like a learning system so that we learn about our own data before we jump into the assumptions of what we need to do? We need to identify the problem first.
Yeah, that's a great question and a great point. So what I would say is I have, you know, I'm generalizing, but the government machine is not particularly good at using or understanding or using any of the data that it has for a number of different reasons. And so I would completely agree that there is a need to better understand the current state, I'll say, and the situation that we're in, the baseline, based on the data that exists. So I think, you know, a little bit, I think, you know, my point around data and evidence was sort of, it's apples and oranges a little bit of what we're talking about, because I always get concerned by policymakers suggesting that they are practicing evidence-based policy. When we really dig into it, they aren't really. They're using data, which is important. But just, you know, collecting counts on, you know, for instance, you know, number of people on a wait list, or, you know, percent of Nova Scotians living in poverty, and then deciding to implement a certain intervention isn't really evidence-based policy. It's at least, you know, informed by information and data, but it's sort of different. That being said, there are huge opportunities to utilize the data assets within the province better, and to better understand what we've got and what situation we're in. So, Brittany, I think your point's well taken.
Thanks, Mike. We're getting quite a few questions coming in, hands going up. I just want to make sure that everybody's had an opportunity to have a question. So I'm going to go to one of the chats before I go to the hand that's up. And the first question that came in on the chat was, Chief Medical Officers of Health were demoted on authority during the SARS pandemic. Is it problematic from a communication standpoint that they are still presenting on government decisions as senior scientists but lack the authority to make decisions on what they're speaking to, meaning that non-scientist politicians are often governing the information the CMOs present? I'm not sure if that was SARS or COVID, but in terms of the pandemic. But anyway, I'll let you decide how to respond to that.
I think if you look across the country from a public health perspective, chief medical officers of health have been, the governance model around public health is different from one province to another. And so here we've got the public health establishment is within the department. In a place like Ontario, it is a bit of a more arm's length organization. You know, and this really all comes, I mean, it's a bit of a, you know, democracy and government question a little bit, right? We have elected officials that we have asked to make the decisions. I think that this is just my opinion anyways, that the best place for those chief scientists, those chief physicians, medical officers of health, the best place for them is to be influencing the decisions. And that means being more closely tied to the decision-making process as a side, instead of being off to the side and sort of weighing in, you know, like an ombudsman type of role would be, and providing advice that the government either does or doesn't need to take. But that is a more formal sort of, the chief medical officer of health has weighed in. It's going to lob that opinion kind of over the fence, and then the government can or doesn't have to actually do anything with it, as opposed to having a more nuanced, sort of meaningful conversation, as the sausage is being made. That would be my 2 cents on that in kind of 90 seconds or less.
Thank you. I'm going to go to Jamie, who has their hand up as well. So over to you, Jamie.
Thank you both. I think it kind of builds on a question that just came through, but I was curious to know if you're aware, and maybe your kind of organization fits into this a bit, but it almost seems to me like we need a separate entity to sit within that gap that has expertise in behavior change, that has expertise in knowledge translation, implementation science, that's really good at brokering partnerships and has a good lay of the land for, scientific expertise and where that exists, and has good skills with science literacy and how to synthesize. How do we know when we have enough evidence to make a good decision? It seems to me you almost need an organization or a group of people that's designated, that champions that has a good close relationship with government, that becomes a trusted partner. But kind of, I find in my world that typically gets overlooked. We talk about knowledge translation, but I think what happens is often in academia, that's not a main focus necessarily for a lot of researchers. They do their research, but they need support. And I find that it falls down sometimes when no one is actually designated to champion moving the knowledge, creating the partnerships, engaging the community. Like that takes a lot of time to do those things well. And I just wonder if it would be worth having, or if you know of, I think MSSU is a good example of an organization that sort of sits in that gap.
Yeah, the short answer is I completely agree. I think there's a huge gap. The UK, I think, has done, so behavioral insights team is, used to be kind of within government, somewhat arm's length, I think, in terms of actually applying behavioral science research. But the What Works centers, I think, are another good example. So I don't know if people have heard of those, but in the UK, there are, let's say, 8 or 9 institutions called What Works centers, and they've each have sort of a certain policy area of focus. So What Works in education, What Works in well-being, What Works in justice. Scotland's got one that's kind of regionally based, and that's exactly what they do. They are the broker between the academic community and the decision makers, and they do a lot of synthesis and help with kind of the making evidence and knowledge, framing it to be more easily practically applied.
Yeah, and I could see, like, you talk about kind of risk-free experimentation maybe could sit in that space, right? And
absolutely.
I think that would be really neat. Thank you.
Yeah, thank you. Great question. Thanks,
Jamie. Yeah, and I'm just going to give a shout out to HPI, because we're actually also trying to do some of that work in terms of the that knowledge translation, really focused on sort of getting research into practice. We are literally a minute away from time. I see another, or actually I think that might still be your hand there, Jamie, but we've had various questions. I really wish we could continue this discussion, but to be respectful of people's time, I do want to just say, Mike, thank you very much. You've obviously generated a huge amount of interest and discussion around this topic. Maybe we need to be having another session with you at some point. Thank you, everybody, for joining us today and for sending in your questions. I'm sorry that we haven't been able to get to all of them, but just want to say again, thank you for your time. Thank you for your interest, and wish you all a great rest of your day. Thanks very much, everyone.
Sarah, thanks, folks. Appreciate the conversation.